So everything you need to know about white fillings. What are they? What are white fillings? How long do they last? Who are they suitable for? And should you get a white filling? Well, I'm going to explain all that for you today. In the past, teeth were commonly repaired with a metal filling called amalgam, and that's a silver filling which is a mixture of metals, or we used gold restorations. Now, gold was expensive, and so dentists were looking for an alternative that would be more cost effective and easy to use. But dental amalgam contains mercury, and gold is only actually 6% gold, and then this means that you've got different metals mixed in. Now, having metal fillings may mean they last a long time, but they're not so great if they potentially contain toxins or create electrical currents in your mouth, or the alloys are coming out from the filling and impacting on your immune system. Well, thanks to advances in dental materials and techniques, teeth can be restored with white fillings called composite. Using a white filling means we can provide you with great looking restorations that has a natural appearance and contains no metals. But be aware, not all white fillings are created equal. Some contain fluoride or BPA, and some are just downright cheap and nasty, and they don't wear well and they can discolor. So as a holistic dentist, I am really fussy about what I choose to put in your teeth. So I'm really fussy about our white filling materials and what they are. And we only use brands that don't have BPA, so they're BPA free, they're fluoride free, and they also do not contain any aluminium. So we're going to make sure they're of the highest quality for you. Now, the best type of white fillings are what we call composite. It's a direct filling, so it means that we place it straight into the tooth. We drill out the decay, there's cavity, and we fill it directly. This is made up of a mixture of quartz and resin and silica, and it contains a light sensitive agent which we activate with a special wavelength of light to make the filling set, so we control that it's set at the time we want it. Also, it's set by the time we've finished your appointment, and therefore you can eat and drink and use that straight away. Now, these light cured composite white fillings are extremely cosmetic and can be bonded into place in one appointment. At first, when this technology came out, they were only used in the front teeth because they weren't strong enough to go in the back teeth, and we had really big issues with moisture control and making sure we could keep the teeth dry enough and free of any contamination for the actual white filling to adhere to your tooth. But now, due to great advances in technology, these white fillings are suitable and strong enough for in your back teeth and for almost every situation. They come in a variety of shades, so we can get a really good match to the colour of your own teeth, and that's really great if you're after a good cosmetic result. So how are these white fillings or tooth coloured fillings done? Well, in order to bond to your tooth, first of all, we have to remove all the decay and have a clean, dry surface, as I'd already mentioned. We've got to have a clean surface to work with. So we prepare the tooth, then we condition the enamel and dentine. Sometimes we'll do air abrasion as well. Now, the enamel's the outer layer, the dentine's the bit in the middle of the tooth. And then once conditioned, a thin resin is applied to the prepared surface, and that allows the white filling to interlock into your tooth structure and actually bond and adhere to your tooth. Now, the bond strength of these fillings is quite incredible, and it has improved tremendously over the last few years. After placement, composite white fillings are hardened by shining the light on, and then once it's placed, it's almost immediately fully set. It's a matter of seconds these days, and then that filling is ready to use. And then we shape and we polish it and we make sure it's contoured in to your bite and you're able to floss properly and all those things. So what can you expect after a dental filling? Well, Your teeth are living things, and when we drill into your teeth, that is surgery on your tooth. So if I cut you open as a surgeon and you had an operation, you're going to feel a bit sore and tender afterwards, and there's going to be a period in which your body needs to heal. So for your tooth, you may experience some temperature sensitivity. You may have that for a few days or even a couple of weeks after having the filling done, and that is considered quite normal. However, if that sensitivity doesn't disappear within a period of time that we recommend, then we'd say, look, contact the dentist, get back in touch, because that may be a sign of a couple of things. It might be that the bite needs a very fine adjustment to allow the tooth to settle back in, so it's not being crushed in the chewing forces, or your tooth may actually need further treatment. I mean, if your tooth was cracked or had deep decay, the nerve may have already been compromised and infected and hasn't been able to recover from the issues that led you to needing a filling in the first place. So you may need further treatment. Now, at Evolve Dental, which is my dental practice, we only use white fillings. We do not use amalgam because we want to provide you with the best filling materials available to make sure that not only do you get a great looking end result, but you get a filling that is going to be hard wearing, long lasting, and works in harmony in your body. And that is really important for us because we want to ensure that we use materials that are non-toxic, non-allergenic, and are free of fluoride as possible. As after all, if we're going to go and see a holistic dentist, you want someone who's focused on providing dentistry that's not going to adversely impact on your health. We want you to have a great looking smile, beautiful oral hygiene and good oral health, and have a great smile for life. So if you'd like to know more about white fillings, or you think you need a filling done and you're in the Brisbane area and you'd like us to be your dental practice, then you can give us a call on 07 3720 1811. Or if you want to know more about dental health, then hop on over to the Dental Zone, check out the other videos and podcasts. Please do like, share, recommend, follow, subscribe, all those things everybody asks you to do. Pop a comment in the comments if you're on YouTube, and I look forward to joining you again next time. I'm Dr. Rachel Hall. This is the Dental Zone podcast, and until next episode, stay in the zone.